The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello, my name is Stoy Proctor. I'm here today hosting Wonderfully Made. We are wonderfully made, but sometimes things go wrong. Today we're going to be talking about arthritis. Different types of arthritis. In fact, there's 100 varieties of arthritis. We're not going to talk about all 100 today, but we're going to talk about some of the things we might be able to do to ease the pain and maybe even make life a little easier. As my guest today, I have Dr. Alan Handysides. Alan, welcome.
Good to be with you.
And you're going to be our guest today. And I'd like to ask you first, what is it?
What is arthritis?
What is arthritis?
Yes. Well, it's a simple word. It really means inflammation of a joint. Mm-hmm. And as such, there are many, as you've already said, many different kinds of arthritis. A joint is classically is the place where two bones come together. And the good Lord made us in such a way that the surfaces of those bones are covered with cartilage, which allows there to be a movement that slips and slides rather easily. A lubricant is provided to that joint by what is called a synovium, or the synovial membrane. Mm-hmm. Now, this is a specialized structure that lines the joint, but not over the surfaces that rub together, but on the inside of the capsule that holds the joint together. And this membrane secretes a lubricating fluid that actually gives a nice, smooth, gliding surface. Around the synovium is the capsule, and then supporting the joint are various ligaments and tendons, and then the muscles. And so we find that we have this very compact place between bones that gives both strength and support, and yet at the same time allows for flexibility and therefore for movement. Mm-hmm. We usually define joints as small joints and large joints. The largest joint, of course, is the hip joint. We have knee joints, and we have then smaller joints, the smaller ones of which are in our fingers and in our feet. And we can get an arthritis. Different forms of arthritis affect different joints predominantly. So there are patterns of arthritis.
Now, my grandmothers, I've got two grandmothers as most people, and both of them had rheumatiz. Mm-hmm. Now, what do you think this was? What is rheumatiz?
Well, rheumatiz...
This was many years ago, of course.
In my family, it used to be lumbago and rheumatism and so forth. That term is a term that has been used over generations, mm-hmm. and it's a lay term that refers to arthritis. Usually, it referred to the form of arthritis that came with aging, which is osteoarthritis. But any of the forms of arthritis might have been called rheumatiz, according to the old-time talk.
Now, I'd like to ask you something, because my grandmothers used to be able to forecast the weather. Is that possible?
You know, this is a very interesting thing. We don't quite understand why that is, but many people who have arthritis are sensitive to possibly barometric changes, pressure mm-hmm. changes, and will be able to say there's bad weather coming along. Interestingly, my wife, she doesn't have arthritis that I have been able to define, but she has had over the years joint pains of a various variety. And she'll sometimes say, I think we're going to have a storm because my knees are aching. Mm-hmm. And I think that that's a fairly common feeling among different people, that they can mm-hmm. sense weather changes, probably barometric mm-hmm. changes. Mm-hmm. Yeah.
Now, there's many kinds of arthritis, as I mentioned earlier, but we're going to have to limit ourselves to maybe a couple of kinds. Tell me about osteoarthritis.
Well, if we have time, we can talk about some of the other forms. Osteoarthritis is the commonest form of arthritis. It's probably going to affect maybe 60% of people are going to have trouble with osteoarthritis. People who are, have a family history of osteoarthritis, again, are more prone to develop it. And people who have some of the predisposing factors, such as heavy manual labor. Osteoarthritis is not an arthritis that is a disease caused by living in an improper way or anything like that, except that it is brought on by heavy physical labor. So somebody who works a jackhammer, for instance, or somebody who is working as a stonemason with a hammer, hammering away at rock and with a chisel and chiseling rock. Somebody who may be lifting heavy weights, a miner. Those kind of people do tend to get osteoarthritis, although one can get osteoarthritis even doing relatively light work and sedentary work if it's a repetitive type of motion. Now, I myself have osteoarthritis in my hands, which surprised me because, having been a physician, I didn't think that I was doing a lot of work. But I was doing a lot of surgery. I used to operate maybe for 12 or 15 hours a week, and using, even though it was small instruments, but I was using a repetitive type of motion with sewing and cutting and repairing tissues and so forth. And I have a little osteoarthritis in my hands. You'll notice my finger, this little finger, has arthrodesed. That may have also been...
What do you call it?
Stuck, yeah, stuck together.
Arthrodesed?
Yes, you see how I can close these fingers? That joint there has kind of stuck up. And what's happened with that joint is that there has been an overgrowth of bony little tuberosities around the joint. The fibrous tissue of the capsule has become stiffened, and at a point in time it was painful. I think I sustained an injury actually to this little finger as well, which speeded up the process. But that's a classic situation for osteoarthritis. Many people get hip osteoarthritis at the hip. That can be a very serious problem. And osteoarthritis then is a wear and tear type of problem.
On the joints. Now, occasionally, a while back, years ago, I watched Roger Staubach. He was a quarterback for the Dallas Cowboys. And I heard him advertising painkillers. Are sports, like contact sports like football, are those players apt to suffer arthritis, osteoarthritis later on in life?
They are indeed. Particularly players that get tackled are likely to have the joints traumatized. And trauma, just like hard work and trauma, can predispose.
So sports as well as some of the manual professions
One of
could be a danger.
The most severe arthritic situations that I remember encountering was in a former hockey player. You know, sometimes we look at the stars of hockey or the stars of sports and we think, wow, what a wonderful thing. But we don't understand that there are very many casualties along the way. And for
they pay a big price, don't they?
Every star, there are hundreds of people who played hard, maybe enjoyed it very much, and I'm not against good athletic activities, but do sustain severe injuries. And we need, if our children and young people are playing sports, we need to be careful that they're not putting themselves at undue risk. For instance, the pitchers in baseball, that repetitive strain, many of them have problems with shoulders and elbows, arthritis, because of repetitive throwing, you know, that ball time after time after time. That's not what we were made for. We were made to function in a balanced way, not in a sort of highly focused way that stresses one joint to the, you know, out of proportion to all the others.
After listening to my grandmothers for years complaining about their arthritis, is there anything I can do, or maybe it's too late for me, but some people can do to prevent it?
Well, of course, we've already been touching and talking about preventing these strains and these injuries.
So don't play contact sports.
So avoid these excessive activities if we can.
Is there any way, though, like say I'm a stonemason, is there any way to avoid this kind of strain?
It might be very difficult.
Yeah.
It might be very difficult. One can, of course, if you have knee troubles or hip troubles, look to your shoes. We need to have cushioned shoe, and there's been a great advance in the last 25, 30 years since all the different shoe manufacturers have given comfortable, springy shoes. That's going to be very beneficial to the knees and the hips of people who wear those type of shoes. When I was a boy, we used to wear, stiff, hard heels and soles. People wore boots, sometimes steel heels were put on those things, and that transmitted a lot of force through the limbs. So good cushioned footwear is a very important thing for protecting. And then, of course, it's important to wear supportive gloves and protective gear in certain activities.
You know, I occasionally, in my lawn tractor, I wear earmuffs to protect my ears.
Yes.
And when I get off the tractor and start walking, it feels like the sound coming my ears, it feels like somebody pounding my ears. Now,
when you take the protective...
No, when I put them on and walk, which explains to me that even when I walk, there's a pounding going on in my joints. I can hear it with these from the earmuffs.
Well, what you're doing is
it amplifies it.
You're cutting off all the other sound. You're cutting out the external sound, and then you're aware of when if you were eating your honey nut.
So shoes, I think, would be important, wouldn't it be?
Very important, because you do transmit forces through.
Now, there's some other things that might increase the risk of osteoarthritis, and that is obesity. Is that true?
It certainly is. Obesity, imagine, we've talked about work. Now imagine that you carry a 50-pound sack of potatoes or grain or whatever else you want to do everywhere you go.
Or extra calories.
Well, if you have 50 pounds of overweight, that's what you're doing.
Yeah, that's right.
Yeah, you're carrying that all the time. And that's a major strain on your joints. And obesity being such a common problem, there's a definite thing that we can do is to take control of our weight. Easier said, of course, than done.
Oh, yeah.
Yeah, because, I feel myself, I got this little thing here. It's not because I don't know what to do. It's because we need to be motivated to have the willpower not to eat so much.
So how does the obese, does that just mean there's extra pressure on the joints?
Yes, extra pressure on the joints, extra wear, extra tear.
All right. I'm good.
Sometimes, we're going to have to address osteoarthritis, though, with a surgery.
You are?
Yeah. My father had osteoarthritis of the knees. As a boy, he suffered rickets. He was brought up in Newcastle on Tyne. It's a mining and coal city in northern England. Very cold, very dark, not a lot of sunshine. And, of course, they dressed from here right down the toes and had a big hat on as well. Very little sunshine. Vitamin D deficiency developed, and he had bow legs. And we used to tease him about his bow legs, but it was a sad thing, really, because it was a fact that he'd had rickets as a child. That meant that as he walked, the pressure on his knee joints were transmitted not evenly across the joint, but to one side of the joint. Yeah. And so when he got to be about 80 years old, he was having a lot of trouble with his knees. And the doctor said, what we could do is do an osteotomy, cut your bone and realign them so that the weight will be distributed to the other side of the joint, and that would free you of some of the pain. Now, today maybe they would have said to him, maybe you can have a joint replacement. We'll take the joint out and we will replace the joint. They've done surgeries like putting caps on the joint, just on the ends of the bones, so that the surfaces that are rubbing against each other are metallic. And we have, of course, arthroscopic surgery, which is very interesting surgery because you take the little tiny tube-like thing through which you can look and see, and they can look inside a joint. That's very useful sometimes if a joint's damaged with osteoarthritis, got little chips of cartilage or bone inside there. They can take those out through little tiny cuts, maybe a quarter of half an inch in size. People can have that surgery done and go away very, very readily.
Are these surgeries quite successful, or do they have to be done over again?
Well, replacement surgery will have to sometimes be done over again.
Maybe what, 10 years,
maybe
15 years?
10, 15 years. And there's the time with the improving joints, that is getting to be longer and longer time that a joint will last. That was why we used to say to people, well, maybe put up with your pain a little longer, because we didn't want to really do a joint replacement too soon, especially if a person was, say, 60. Maybe if you could put up with it for 5 years.
What's the problem with having replacement of the replacement?
Well, the problem with the replacement, nothing is as
Except
good.
expense.
Nothing is as good as what God gave us. We are indeed, as our program says, wonderfully made, beautifully made. And when you replace a joint with a manufactured joint, it works fine, but I've seen them when they've been taken out, and the ground up edges and the ground up surfaces, the wear and tear that the joint undergoes. And our normal joints repair themselves, self-reparative joints. So
marvelous.
Marvelous. It's absolutely fantastic that that can take place. So yes, it's good that there's a hip or a joint replacement, knee replacement, but it would be so much better to preserve what God has given us if we could.
Now, my grandmother, one of my grandmothers, was told that she could get relief by standing. Now, in Texas, we have red ants. Red ants about a ½ inch long, and they are sting, and they're very painful. But she was told if she went out in this bed and got stung by ants, that would relieve her arthritis. I don't think it did. Do you know anything about this?
Well, of course,
that's an alternative remedy. But what I'm leading at is that, are there some kind of relief? Is there something we can do to relieve some of this pain in lieu of surgery?
Well, of course, the simple pain relievers have worked well and continue to work well. Aspirin, as you know, was an extract of willow bark, and was...
That's natural, right?
It was natural originally, and then it's been synthesized. So aspirin is a very good pain reliever. Of course, it's hard on the stomach. It may cause bleeding in some individuals, so it's not something that you can take easily. Tylenol is less irritative to the stomach, and it metabolizes to some of the similar ingredients. So Tylenol will work. Then we have a whole class of medications called non-steroidal anti-inflammatories, and they've been used with some degree of benefit, but they also are irritative to the stomach. The latest ones which have been in the news are Vioxx, and we've also seen some problems with that. They're what we call COX-2 inhibitors. The COX-2 inhibitors interfere with the inflammatory process in a different place, but they have been found, Vioxx has been found to increase your risk of heart attack. So when we talk about treatment for arthritis, yes, we really do want to avoid it if at all possible, and then we want to use as mild a medication as we possibly can. It's important not to forget some very simple things that can help for arthritis. Heat and cold, you know, is something that will very often help. Now, we don't usually heat an inflamed joint, so we could talk about rheumatoid arthritis. We don't heat an inflamed joint, but osteoarthritis may benefit from warm, and we can alternate that with warm and cold.
All right, to get into the details, how long, if I have a joint that's inflamed and hurting, how much cold, what kind of, how do we put cold on there, ice pack?
Well, yes, an ice pack would be a good way. A heating pad would be fine.
Heating pad, that would be mild, right?
Or if you're using, you must be very careful using hot water bottles and those sort of things, because you can burn the skin. And if there's a diabetic that's being treated, or if there is any evidence of nerve insensitivity there, you've got to be very, very careful with heat. But you can put warm packs around. You usually put a warm pack, something that you may heat, or it can be an electrical pad that you heat. You apply that around the affected area or over the affected area, usually for 5, 6, 7 minutes. Then you remove it, and then you can have an ice pack. And an ice pack you can make by crushed ice inside a towel or a plastic bag first, and then a towel. And you apply that, and then you just cool the joint. You then alternate the hot. You can do it with water. actually a very, very good way to heat and cool. If you can immerse, if it's an ankle or something, you can immerse it in warm water, then in cold water, again for 5 minutes, 10 minutes. You always want to end up with a cold application for osteoarthritis, because the cold chills it out. The warm brings more blood there, so improves the healing.
Now, I have a brother-in-law that took one of these thermophores, these heating pads, that they have a cutoff switch on it, which is automatic. But he was very clever. He propped something up against that cutoff switch and left it on and went to sleep.
And he could leave himself with a big burn in his skin.
And when he woke up, his fingers were very inflamed, and they had to remove one of his fingers and half of the other.
I've seen people with burns the size of saucers because of heating pads. Be very careful.
These automatic cutoff switches are there
important.
for a purpose.
Very, very
right,
much,
and so don't try to outsmart them.
You know, I see that we're going to not have a lot of time. Some people will be suffering with rheumatoid arthritis.
That's exactly right, and that's our next topic, next part of our topic. What about, now what's the difference between rheumatoid and osteo?
Rheumatoid is not a wear and tear situation. You know, the Adventist health studies showed that people who were vegetarians actually had less rheumatoid arthritis, not the other kinds of arthritis, not gouty arthritis, we're not talking about that. But vegetarians had less rheumatoid arthritis than did the others. It wasn't a very, very major reduction, because some of the rheumatoid arthritis is hereditary. It occurs much more in women than it does in men. But it's an inflammatory form of arthritis. The synovial membrane, which I mentioned at the beginning, becomes inflamed. And it becomes inflamed probably because antibodies are attacking it. Now, what triggers that immune response, that the body is rejecting its own joint, we're not sure about. It may be that there are infectious agents that are doing that. It may be that there is something in the environment. There may be some toxin or something that we are eating that is stimulating this. And it may not be the same factor for everybody. But the end result is that the joint membranes become very inflamed. And those inflammatory products that are poured into the joint damage the cartilage. So people who have rheumatoid arthritis are subject to joint damage as a result of the inflammatory process. And today we're much more aggressive in treating rheumatoid arthritis than we used to be, because it's recognized that that joint damage can take place early in the onset.
So let's suppose I've been diagnosed with rheumatoid arthritis, but I've heard from the supplement people that there's some alternatives out there. Is it wise to experiment with some of those alternatives while that process is going on damaging my joints?
Well, chondroitin has been recommended as a treatment. Some of those alternatives, quote alternatives, may not be alternatives for too long, because once they are shown to work, they will then be incorporated into the normal treatments. But a person who has an acute flare-up, for instance, somebody may start with rheumatoid arthritis in a very, very dramatic way. Rheumatoid arthritis usually tends to be bilateral in its distribution. It may affect the joints of the hands, the elbow, knees. It doesn't usually affect the vertebral column, the spinal column. But if you have a very sudden onset of rheumatoid arthritis, then that is probably not the way for alternatives.
How do they treat it?
Well,
what do they do for it? You got it.
They have many different treatments. Some of the newer treatments that have been used actually interfere with the immune process itself. And so what they do is they try to intercept, one of them is called etanercept. It tries to intercept this reaction of rejection of your own synovial tissue. And these are very, very interesting medications. They are working well, but I don't believe personally that we have had a long enough experience to be able to say definitively that they can't have some serious side effects. And so one has to
is there a cure in sight?
I don't know that there is that we could say that at this point in time we have a cure in sight. I think our understanding of rheumatoid has become very, very profound. Rheumatologists understand to a great extent, and it could well be that research into rheumatoid is going to give us benefits. Mm. I think I'd like to sort of, rather than focus on the drug therapy, and people are going to have to see their doctor for the drug therapy.
That, yeah.
I would like to talk about some of the things that people can do who have rheumatoid arthritis.
Yes, some of the treatment, some of the home
some of
type
the
of treatment.
methods of management.
Okay.
It's very, very important for a person with rheumatoid arthritis to avoid trauma to the joints. And
like
yet,
lifting heavy weights?
Like lifting heavy weights, straining, running, putting excessive pressure. And yet it's very, very important that the range of movement of that joint should be maintained.
So lifting weights is probably not the best thing to do?
We need to maintain the range of movement. Mm-hmm. We need to maintain the strength. We need to protect from trauma. So this is a situation where we need gentle exercise, mm-hmm. and not a strenuous exercise. And the strengthening, the muscle strengthening, may be done through isometric type of exercises. You all remember Charles Atlas, I'm sure. You know, remember
some of the older people.
Older people remember Charles. Mm-hmm. I saw adverts actually, the Charles Atlas method. That's where we flex our muscles, but we don't move the joints. Mm-hmm. That can maintain the strength without traumatizing the joint. So that is very important. Swimming is a weightless situation, but mm-hmm. you can go through the full range of exercise. And I always remember the rheumatologist when I was in Edinburgh at medical school there. He said, if you ever grow, and you guys are going to grow in prestige in the medical profession, one day you might be in charge of a rheumatology unit. Remember, the most important piece of equipment is a therapeutic swimming pool. Mm-hmm. And whirlpools and swimming pools are a very, very useful way for people with arthritis to be able to exercise and yet not to damage their joints.
Well, this has been a pleasure today discussing this topic. I think this condition, this wear and tear on our human body, certainly affects a lot of people. And let's just, in about 30 seconds, recap some of the things that we can do ourselves. Increase our flexibility, increase our strength gently, because we don't want to put any pressure, right, on our joints. Is that we can apply hot and cold, mild hot,
hydrotherapy,
hot and cold, and watch the thermophore. Don't let that automatic thing work, because you don't want to burn yourself. You don't want to lose your fingers like I have. Well, not for that reason, for another reason. But so these are some of the things we can do. And be sure you get good help.
And our
Dr.
apologies,
Henneside,
of course.
I thank you very much today for being with us.
Apologies to those people who have arthritis of other causes that we didn't have time to talk about.
Yeah, it's a serious thing. Go see your medical professional, an expert in this particular area, so that you can get help as soon as possible, so this damage to your joints can certainly be reduced and you can live happily.